we go, girls. Welcome to Real People, Real Stories. We're excited to bring another guest to you tonight. And my name is Dr. Barbie Phillips. I'm from Fargo, Oklahoma. I'm a chiropractic physician for people and animals. And we are super excited to talk to you about redox molecules and how they're changing people's lives. If you're not familiar with redox molecules, we're born with them, but after puberty, we lose about 1% per year ability to make them. And they're what helps our cells talk so that we can be healthy. So what does redox do for you? Redox is a consumable liquid or a topical gel. And by replenishing the body with these tiny molecules, they get into the cells and they act as an on-off switch, which means they turn the good cells on and they work to turn the bad cells off. And by doing that, then they can have a cascade effect to other cells and affect those cells around them so they can be healthier. And then over time, that leads to your ability to adapt to the environment and stressors better and overall health and wellness. So we are excited to hear our guest story tonight. I am going to put a disclaimer in here first that we are in our talking tonight are not intending to diagnose, treat, or prevent any medical condition. What you will hear tonight is just real testimonies from a real person and the use of redox. So I'm going to turn it over to Kathleen and let Kathleen introduce our guest, which is actually from Nashville, Tennessee tonight. Thank you, Kathleen.
Well, it's wonderful to be here, and I love technology and love that we can be anywhere and be connected. Being connected to Cyndi Reed is an honor. She is not only a fabulous just person, she also brings a wealth of knowledge in the medical community. And I really have looked up to Cyndi and always appreciate her wisdom on things and also her medical knowledge. But Cyndi, we are so glad that you joined us tonight. And as a registered nurse, I'm just so interested to know what you really think about this redox technology and what has it meant to you and what have you seen happen to it? And tell us a little bit about yourself.
Okay. Well, thank you, Kathleen and Barbie, for having me on, but I think you're building me up a little too much here. I actually am originally from Mississippi. I moved here 4 years ago, so I'll take both states, actually. So as a nurse, I'm a nurse here in Nashville with hospice, so my challenge with that is that I can't share it with my patients because of the work conflict. But with redox signaling, when I came across it, I was on a journey to look for alternative methods for my health. I tested positive for 4 autoimmune challenges and just really searching, and you have to be your own advocate with your health because I went to the 3rd provider before I was correctly diagnosed because they weren't running the right lab test. So ask questions. If you don't like what your doctor's telling you, definitely go get a second or a 3rd opinion, as in my case. So with this, I've been on this almost 4 years now, drinking it, using most all the products. And at this date, I am not exhibiting any symptoms of any 4 of the issues, and I'm not on any medication, prescription or over the counter. Energy is great. And I like the fact that this company addresses so many different things, different ways to work on our health and our bodies. So from the inside out, from the outside in, it's been awesome. And I've not been disappointed by anything that they've come out with so far.
Cyndi, you mentioned that you had 4 different issues, concerns, and now those are, I guess, somewhat taken care of. You, I can't believe you're not on any medications, but tell us a little bit maybe about before you were on redox signaling molecules and some of the other great products and after. What has changed for you?
Okay. Very fatigued, obviously on medications to help support some of the issues I was having. Fatigue was a big one. And sleep was a big one. Just didn't sleep very well or all the way through the night. Those are my 2 big things that really, sometimes I really have to make myself go to bed at night because I'm still up and going. And I'm thinking, Cyndi, you need to rest at some point. And the sleep is much better as well. So those were the things, and just not having to worry about a medication. We don't realize so many of the side effects that medications have. And I don't think a lot of the doctors actually read the side effects because there's so many medications out there. There's no way they could know everything. But when you pull out a prescription and there's a package insert and you have page after page of possible side effects. I mean, even though they could be slight, you don't want to be that 1%. So if there's an alternative method that is native to your body and not non-toxic, why would you not want to try that? It just really, I want the world to know this, because what the medical community could do with this right now would be astounding if everybody just jumped on board with this.
So you've mentioned that, because of your background, being a registered nurse and what it could possibly mean for so many of us, I guess, what really turned you on initially about this, or what got you interested in REDOX and ASEA?
Okay. I'm kind of a science geek, so I've always been interested in science and almost went to med school, and I opted out of that. I just didn't think I had that commitment for that length of time. The thing that got me was the fact that it was native to your body and non-toxic. And years ago, I read a book called The China Study, which was by T. Colin Campbell. I'm not sure exactly when it was published, probably close to 20-something years ago, because I was reading it on a flight to Atlanta one time for my job. And my family actually would make fun of me because of the stuff in there that I would, talk about. And they just thought all this was, crazy. But now look at how the world has kind of drifted toward the natural alternative methods for things. So yeah, that's okay. I'll take it.
When you first started to consume the products, the gel or also the liquid, how long did it take you to see results or feel those results?
Okay. The sleep and the energy, probably within a couple of weeks. And as I went on, the energy definitely. But to get where I am today, it took months or years. And it's still going because we don't know what it's doing on the cellular level. We don't know what it's working or possibly preventing on the inside. So I will never not take this, but it's just amazing what it can do. And it's just awesome. You just want to really, because you don't know. And that's the thing. If you try it, you can't just try it for 2 or 3 months. I tell people to try 3 to 6 months minimally, because it's just going to take time. And some people, depending on the issue, it could take longer, but just know it's not hurting you and it's doing something. You've just got to be patient with it.
So when you say we know it's not hurting you, expand on that just a little bit. What do you mean by that?
Okay. These molecules, you're born with them. So anything you're born with obviously can't be toxic to your body. So we're putting these back into our body because over time we lose them because of age or exposure to all the toxins in our products and our food and our environment. So this is just giving us a chance to refuel, so to speak. So think about it like this. Say you go to the hospital, you're very tired, very weak, and they do some lab work and they discover you're anemic, meaning you're a little low on your red blood cells or blood volume, and they want to give you a blood transfusion. And you say, no, thank you. Why would you say no, thank you to that? So why would you say no, thank you to this? Because it's just replenishing your body with your natural fuel and your ability, to help your body potentially take care of issues.
So it's pretty safe then, is what I hear you saying.
It's definitely safe. It's safe like water, but it's not.
Exactly. So, and you mentioned that you also use the gel. Tell me a little bit about that product and maybe how it's helped you.
Okay. The gel has helped with some discomfort that I've had in my body, but I've actually had some skin issues, some spots on my skin, different parts of my body that I've used over time, and they're actually fading. And one of them actually is pretty much gone altogether. So with this, and I use it on my face as part of my skincare regimen twice a day. And, the big 60 is coming this year, and it's hard to think about that, but I don't feel 60. I feel younger than I did 4 years ago when I started this product. So, I'm happy with it. Everything that I've used, and the Renew, the gel is a concentrated form of the liquid molecule. So you're getting 2 to 3 times the strength of what the liquid is. And again, it can't hurt you. So
tell me more about, I feel younger today than I did 4 years ago before I started to take that.
Okay. Like I said, just the energy, I'm still going. There's not a lot I won't attempt to do. I like to hike, work out. Not as I don't have as much time as I should to do that, but yeah, we fit that in. It's just yeah, it's just great.
And you've probably seen a lot as a registered nurse. You've seen a lot of medications and drugs come along. And
Yeah.
so, how is this different, or where do you see it as being different for you?
Okay. Well, the fact that there's no side effects and there's nothing that it can hurt you with. So just using it, and I'm seeing, because some people try topical gels and different things for long periods of time with very little results. And so with this, you can actually put it on someone and do like a core test or some little tests that we do here, and they can see amazing results right away. So that's the good part about this. You can show people instant results of how the topical works. And so that's proving that the liquid works as well, but it's just going to take time with the liquid.
Well, in wrapping this up, and we do appreciate you taking some time with us today, what would be something you might share with somebody if they're thinking about taking this or investing in this? What would be some words of wisdom you might share with somebody who's considering taking the redox signaling molecules?
Okay. I would tell them definitely try it. Definitely give it a full thorough test. Like I said, I would really like to see someone do 6 months. And if there's other issues like they're worried about side effects or interactions with medications, that won't happen. If they're worried about cost, then I go back and say, okay, so do you get a cup of Starbucks coffee every day? Is that something you could cut out? And what is the Starbucks coffee doing to you? Or I might say, depending on what's going on with them, maybe ask what medications they're on and ask, is this helping you? And if not, why are you still taking it? And even so many doctors, and I'm going to kind of go down the wrong avenue here probably. So doctors will put patients on medications for certain issues that have a lot of side effects. And it's not working necessarily, or they don't feel it, but they keep taking it. So, and if they say they don't feel this, but yet they're taking all these other medications they don't feel, and they won't feel unless they do some type of measurement, usually, unless it's like a lab test, blood test of some sort, or an endurance test of that nature. So with redox, it's kind of the same thing. You may not feel it, but you see results, or you can measure specifics with some lab test, or you can measure with, you know, endurance races, physical fitness abilities, things like that. So yeah, I always try to have a rebuttal for their concerns.
Definitely. Well, Cyndi, thank you so much for taking out some time and sharing a little bit about your perspective with redox signaling molecules. Oh, leave us with a little thought about visiting the ASEA headquarters, because I think you just came back from there.
I did, and I got to meet Barbie, and I was so excited to meet Barbie Phillips there. It's amazing. So the tech to go into the facility and to see the production and how these molecules are made, it's just amazing. And just to know how this was done. And there's some videos y'all may want to show at some point on your site too that goes into a little bit about the technology of how it was produced. But it was amazing. And then just meeting with corporate. And I mean, how many companies or how many out there working with your corporate job can you go to the headquarters and meet the big guys, or go to a production facility and where you walk in and they show you everything, well, everything but the secrets, but yeah, it's just amazing. So this is what we have here. It's a culture. It's not just a job, or it's not even a job. It's our passion, and I'm sure you and Barbie feel the same way.
Definitely. Yes, so much. So, Dr. Barbie, I'm going to kick this back over to you now. Let you wrap this up.
All right. Well, thank you so much, Cyndi. We've really enjoyed hearing your testimony and your information about ASEA. I know that you have also a Zoom call coming up that you're going to be leading, and I appreciate all your hard work that you do and to spread the message. So we just invite everyone to really consider the redox for your lifestyle and your wellness lifestyle. And we want to also mention, be sure and get with a reputable associate like Cyndi or Kathleen or myself to purchase your products. If you buy it online, you don't get the benefits of having the guarantee from the company. You also don't know what you might be getting in the bottles. And so we encourage you to reach out to us. our contact information. You can find us on Facebook or at Creation Chiropractic. You can also call the office at 580-698-2852 if you'd like more information. And a special note, the information we videoed tonight is recorded and it will be shown on the Creation Chiropractic YouTube channel. So once again, thank you, Cyndi, and everyone can join us again in 2 weeks, June 13 at 6:30 p.m. Central Time, to where we'll hear more about real people and real stories and how REDOX is affecting their lives in a wonderful way. Thanks again, Cyndi.
Thank you, Barbie and Kathleen.